like to call the January 3rd, 2022 organizational board meeting to order. Welcome and happy New Year to everyone. The county administrator would like to make an announcement at this time. Pursuant to the state of emergency declared by New York State and Executive Order 11, in effect until January 15th, 2022, suspension of the law allowing attendance of meetings telephonically or by other similar device. Additionally, the mask mandate has been extended to February 1st, 2022. Thank you. And at this time, I'll accept nominations for temporary chair.
I'd like to nominate Kevin Akers.
Mr. Sheridan nominates Mr. Akers. Can I get a second?
I'll second that.
Sure.
Seconded by Mr. Denisha. Are there any other nominations? If there are no other nominations, may I have a motion to close the nominations for temporary chair? Mr. Perkins, seconded by Mr. Smithers. All those in favor?
Aye.
Any opposed? Seeing none, motion carried. Now the vote for temporary chair. All those in favor of Mr. Akers for temporary chair, please say yes.
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 Is there any opposed? Seeing none, Mr. Akers will serve as temporary chair for this portion of the meeting.
Oh, so check.
Thank you, everyone. I want to admonish Mr. Lightfoot for not having a tie on. Where's your tie? Fortunately, you're muted. Okay.
I got it at home.
Okay, thank you, Joe. So first up is I'd like a motion for suspension of the rules, moved by Mr. Curran, seconded by Mr. Perkins. Any discussion? All those in favor, signify by saying aye.
Aye.
Opposed, motion carried. Roll call for attendance, Ms. Kelly.
Reagan,
Here.
Forsythe,
Here.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Fay,
Here.
Haggard,
Here. Sorry.
Piacco,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran,
Here.
15 present.
Okay. Thank you. For tonight's prayer, I believe Mr. Denisha, prayer, and also then the pledge.
Sure. Dear Heavenly Father, we give thanks for the democracy alive in our country, and for the freedom to gather here this evening. To gather here to reflect upon yet another year that has passed, and more importantly, to prepare for the upcoming year and the challenges and responsibilities that we will face as elected officials and representatives of the people of St. Lawrence County. We ask that you send your creative spirit upon us and enable us to draw upon the wisdom and experience of yesterday as we respond to the questions and concerns of tomorrow. Give us the confidence to speak the truth boldly, yet with kindness. Give us the patience to listen openly to one another without prejudice. Give us the wisdom to discern what is right and just. Give us the strength and willingness to explore new possibilities. Please guide us on our journeys home at the end of this evening and grant us all a safe return. We ask all these things in the name of our Lord and Savior, Jesus Christ, with whom all things are possible. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so first up on our agenda is nominations for the chair. Entertain any motions for chairman of this board. Are there any, Mr. Denisha?
Mr. Chairman, I would nominate legislator Lynn Sheridan.
Okay, is there a second to that nomination? Seconded by Mr. Perkins. Okay. Are there any other nominations for chair? Mr. Burke?
It is my honor to nominate Margaret Haggard for the position of the chair.
Is there a second? Second by Nicole Terminelli and Mr. Arquette. All right. Okay, so are there any other nominations? Seeing none. So I'd like to have a resolution that for a motion to close the nominations for chair. Moved by Mr. Perkins, second by Mr. Curran and Mr. Smithers. Any discussion on that motion? Seeing none, all those in favor of closing the nominations for chair, signify by saying aye.
Aye.
Opposed, motion carried. So now we will vote for the chair. And how we do this, and to the public, is you nominate by name the individual that you want to serve as your chair. So I would open it up to Ms. Pearson.
Reagan,
Sheridan.
Forsythe,
Sheridan.
Lightfoot,
Sheridan.
Sheridan,
Sheridan.
Smithers,
Sheridan.
Denisha,
Legislator William Sheridan.
Perkins,
Sheridan.
Akers,
Legislator Sheridan.
Fay,
Sheridan.
Haggard,
Haggard.
Piacco, Haggard, Burke,
Margaret Haggard.
Arquette,
Margaret Haggard.
Terminelli,
Legislator Haggard.
Curran,
Sheridan.
10 Sheridan, 5 Haggard.
So Legislator Sheraton is now our chairperson, and please approach the desk.
Thank you. This time, I'd like to thank this legislative board for allowing me the honor of being your chair once again this year. As I said last year at our organizational meeting, I will try to be fair and do what is best for all the citizens of St. Lawrence County. My hope is that this year we'll continue to focus on maintaining fiscal stability status. It wasn't long ago that this board brought down a $21 million, not this board, but this the legislatures in the past have brought down the balance of our fund balance to negative $3 million. We're having to borrow millions of dollars just to make the payroll. Thanks to our efforts on this legislative board, the one before this one, our administrative staff and our efforts, employers' efforts, we're now in have a fund balance of $31 million. So that's a pretty nice thing to be proud of, and it'll keep us safe in the times that are coming ahead of us with inflation and so forth on the rise. I'm also proud to acknowledge that for 7 years in a row now, we've had no tax increase, that tax rate increase. So that's also something we can be proud of. I had Ruth put together some notable items for me this afternoon on some of the things we've accomplished here this year. One of them is Standard & Poor's bond rating review upgrade in January 2021. Another one was the 2020 single audit, no findings, the 4th consecutive year. We started to decentralize county departments with highway outpost, a satellite office for social services. The report continued in 2022. Clinical services, mobile clinic unit project to deliver services to citizens. Opioid litigation settlements, and broadband survey through bank and committee appointed to bring recommendations. Emergency services, interoperability project, 2 more towers in Hammond and Waddington online, and 2 additional potential towers needs being assessed. 11 environmental property actions to clean up and return to the tax rolls. COVID-19 response ongoing, vaccine booster distributions, a decrease in the property taxes for citizens that I just mentioned, continued pattern of not overriding New York State tax cap, bail reform and discovery legislation implemented, opioid treatment program, county provides services to citizens, American Rescue Plan funds, public survey and committee appointed to bring recommendations, Moody's Investor Services bond rating upgrade. This is a pretty proud list of items to be talking about here tonight of our accomplishments and what we're working on. So thank you. Appreciate your support. The next thing we have on the agenda is nominations for vice chair. Is there a motion for vice chair? Mr. Forsythe. Larry Denisha. Is there a second? Rita Kern and Mr. Perkins and Kevin Akers. Do we have a voice vote on this, Kevin?
Are there any others?
What's that?
Other nominations?
Are there other
Oh,
nominations?
excuse me. Are there any other nominations? Sorry about that.
Suzanne,
Suzanne, go ahead.
Thanks. I nominate Nicole Terminelli.
Motion's been made. Is there a second? Mr. Burke seconds, and Ms. Haggard seconds. Did we have a voice vote on that?
close the polls.
Is there any other motions? Any other people? Is there a motion to close?
Yes,
Mr. Riggs?
Mr. Chairman, I make a motion that we close the polls and move to a roll call vote.
Okay. Second by Ms. Kern and Ms. Smithers. Mr. Smithers? Go ahead, Kelly, roll call.
We have to vote first on the closing the polls.
Closing on the polls, okay. All in favor?
Aye.
Opposed? Carried. Now we can go ahead, boys.
The vote will be call the name of Denisha or Terminelli. Reagan,
Denisha.
Forsythe,
Denisha.
Lightfoot,
He's muted.
You're muted.
You're muted, Joe.
To apologize, there was a nurse in here. I vote for Mr. Denisha.
Sheridan,
Denisha?
Smithers,
Denisha.
Denisha,
Legislator Denisha.
Perkins,
Denisha.
Akers,
Legislator Denisha.
Fay, Haggard,
Legislator Terminelli.
Fiaco,
Terminelli,
Burke,
Nicole Terminelli.
Arquette,
Nicole Terminelli.
Terminelli,
Terminelli.
Curran,
Mr. Denisha.
9 votes for Denisha, 6 for Terminelli.
Thank you. Next, we have the approval of the agenda. We have a motion to approve the agenda. Mr. Akers makes a motion, seconded by Ms. Kern. All in favor?
Aye.
Opposed?
Bill,
Yes.
we need to amend the agenda to include that last resolution,
Okay, let's,
the vacancy resolution, and to add update for COVID.
all right. Do we have a motion to make the amendment or to amend the resolution?
Chairman Sheridan, I make the motion that we amend the agenda to include the authorizing filling of vacancies and the COVID-19 report from Dr. Williams and Julie Munger.
Seconded by Ms. Kern. Any discussion? All in favor?
Aye.
Opposed? Carried. And now we're gonna have a COVID update by Dr. Williams and Julie Munger. Who would like to go first? Julie?
Yes, thank you. Okay. Can you see my main screen?
Yes.
Yes, okay. So as of today, we have 18,106 cases to date. We have 14 individuals currently hospitalized, 872 active cases, and 17,075 individuals have completed isolation, and there have been a total of 159 cumulative deaths. For the hospitalizations, as you can see, we have declined from where we were in December, but we are still higher than where we have been throughout the summer. So we have been for the month of January, which is only 3 days, in the low teens, and that is trending down the way we would like it to be. For our weekly cases, we have so far, as of today, with 1 day remaining in our reporting period, and this does include New Year's Day when there was not a lot of testing, 778 cases to date. So that is relatively high and one of almost our second highest week so far. We did report out our highest case count on December 30th of 184 cases. Her average new daily cases per week is 129.67, and that is for a 6-day average, not a 7-day, as we still have tomorrow to add into it. So that has trended upward. And then for our weekly school cases, so for the month of January, so far we've had 39 cases since January 1st. our weekly average, so because of how our averages count from Wednesday to Tuesday, it encompasses part of December into January, we had 115 cases for that 1 week. For the month of December, our weekly average of K-12 cases was 162.5 per week. Our weekly college cases, the colleges are not in session at this time. They are coming back varying days throughout the month of January. The colleges did have 26 cases this week, and most of those are, some of them are students, but most of them are staff and faculty. For our isolation and quarantine numbers, we have, like I said, 872 people active on isolation. We have 615 people in quarantine, and then we have a total of 72,871 people that have been through the process. So monthly cases by age, for the month of December, we had 2,998 cases. The majority of cases were in that 20 to 44-year-old range, but we did have 26% for the 0 to 19 population. That's that school-aged group. And that has stayed relatively consistent around the 25, 26, 27% for the last several months. For hospitalizations by age group, it is staying relatively similar in the age ranges for where they are. We did a decrease from November to December with 76 hospitalized. And just as a reminder, our hospitalizations go by the way we track data by the date that they counted as a case. So if they were a November case, so say they started on, we counted them as a case on November 30th and they were hospitalized in December, they'd be included in the November numbers. Vaccination status of hospitalization. So I know this is something that several of you have asked for. So the age ranges are the age ranges that we've been providing. So we have, this is for December, the total number of hospitalizations per age range, and then those not vaccinated versus vaccinated. And so as you can see, 75% of our hospitalizations for December were not vaccinated and 25 were. Dr. Williams is going to go into more detail with his presentation about the rate of hospitalization, which gives you more detail than a percentage does. For our county statistics, as of today, our positivity rate was 6.36. That is starting to trend down. One of the things, though, that with the positivity rate is they do not include any of the home tests that are starting to increase in popularity with getting reported to us. Home tests are just reported out. There's no mechanism to report them to the state. We do not enter them into a lab system because they were not done at a laboratory set during like a doctor's office setting or a lab setting for confirmation. So that all of the home tests that are reported to us do count towards our case count to give us an accurate idea of what's happening, but they are not included in that positivity number. So our total population that is fully vaccinated is at 58.3%, and that is relatively low compared to the rest of the state. And then the percent of our eligible population that 5 years and older that is vaccinated is the 61.4%, and that's with one dose. For our vaccine distribution, our department overall since last January, so in the last year, we have provided 7,534 first doses, 6,696 second doses, 1,685 booster doses. We did do a second round of migrant vaccinations. We provided 67 boosters, 2 Pfizer second doses, and 16 Johnson & Johnson. And as always, we still have our contract with the Volunteer Transportation Center. So if anybody does need a ride to get to a vaccine appointment, they can call for a ride too, and they will wait while you're in your observation period. For our vaccine clinics coming up, due to the increased demand of people looking for boosters and it being required for more different individuals, depending on if you're a student or faculty staff, we have worked to increase availability. So for the month of January, every Monday from 8:30 to 2, we are doing Pfizer 12 and older. That's first, second, and booster doses. Booster doses, we do require pre-registration. First and second doses, you can pre-register or you can walk in. Every Tuesday, we are also doing from 8:30 to 2:30, we're doing the Moderna booster, which is for anyone 18 and older. And then for pediatric, the 5 to 11-year-olds, every Monday from 2 to 4, we are offering first and second doses. And then every Friday from 8:30 to 4, we are doing first and second doses for the 5 to 11-year-old. And the links for all those are on our website, and they have been sent to all of the schools. We did today also hold a Johnson & Johnson clinic from 8:30 to 2, and we will be putting a couple more up throughout the month. For community clinics, we are starting to go around to our different community centers again. So this week on Wednesday, we are at the Governor Community Center. Next Wednesday, we're at Ogdensburg Free Academy, and the following Wednesday, we are at the Messina Community Center. We are doing our Monday clinic on Martin Luther King Jr. this day, so we will be operational on the holiday. Booster eligibility update. So today, the FDA amended the emergency use authorization for Pfizer so that to include boosters for the 12 to 15 years of age. They shortened the time between the completion of the second dose and booster to 5 months. They are allowing for a third primary series dose for certain immunocompromised children for 5 to 11 years of age. So as it did with the other vaccines, the FDA, once they meet and do their approval, the CDC convenes, which they will do on Wednesday to discuss the changes. Once the CDC gives their approval, then the New York State Department of Health will review the data. Once New York State Department of Health approves, the above vaccines are eligible to be given in New York. Moderna will stay at 6 months at this time for the booster. The above only pertains to Pfizer. So quarantine and isolation guidance, we've had many questions on this. So we follow the New York State Department of Health guidance for quarantine and isolation. They are still reviewing the latest CDC recommendations, although on December 24th, they did issue guidance shortening the isolation period for certain fully vaccinated healthcare workers and other critical workforce. So individuals working under this policy must continue to stay at home and take precautions to avoid household transmissions and observe the required elements of isolation while not at work until the end of the 10-day period. This is similar to what the state had for essential workers for people on quarantine last year. It has flip-flopped and it's now for people that were positive or are positive. So with this, there needs to be a critical staffing shortage to allow an employer to have a person return to work after day 5 of their isolation period. So if the individual is a healthcare worker or other critical workforce member, they have to be fully vaccinated and they have to be asymptomatic or had mild symptoms that have resolved. They cannot have had a fever for 72 hours. They have to have their symptoms improving or resolved. They cannot have a runny nose, and they can have, if they have a cough, it has to be minimal, non-productive, and not disruptive to work. With that, the individual also has to consistently and correctly wear a well-fitting mask, which is a higher level mask, which is a KN95 or fit tested N95. The mask should fit with no air gaps around the edges. For healthcare settings, it should be a well-fitting surgical mask. In other settings, should be a well-fitting disposable mask that's not a cloth mask, unless you're double masking with a disposable mask underneath. And individuals who are moderately to severely immunocompromised are not eligible to return to work under this guidance. An update on our school testing program. So through our quadrant program, we have tested a total of 12,140 individuals so far and identified 97 positives. BOCES did receive a shipment of test kits over the weekend for distribution to every student. These tests will be distributed by the schools and will be used for screenings, and parents should expect to receive a communication in the upcoming days from their individual school district about the test. Another update is the test to stay. So that's a strategy that does allow asymptomatic, unvaccinated, school-based close contacts to avoid school exclusion, but not the other restrictions of quarantine by testing negative through serial testing during a 7-day period. At this time, we do not have the resources to implement this in the county. We have requested additional testing and information and staffing necessary to implement this, and we are working closely with the State Department of Health and our school districts to bring this to our county when we can. But with the test to stay, some of the challenges are not only not having the resources, but if the test is done in an unmonitored setting, a mechanism must be in place to ensure that the test is done correctly on the correct person and in accordance with the package insert. And then also, this is only for school contacts. If a student or faculty staff member were to test positive due to a family member or be considered a contact due to a family member testing positive, or they went to youth hockey or a dinner party or something outside of school, then they would not be eligible for this program. So schools are going to have to track the types of exposures that every student had. On top of that, the students are only allowed to participate in school in the in-person instruction. They are not allowed to participate in community activities, extracurriculars, sports, clubs, or band, chorus, anything outside of the school. And then we have also, with the increase in home tests, we have updated the way to report home tests to us. And hopefully this will be easier on everybody. We now have an online form that you can click on our website to fill out the information. It'll come directly to us and you will get entered into the system for a phone call. You won't have to call us. Our call volume is very high still right now, so that there is some frustration on people trying to get through to us. So if you test positive with a home test, we do have an online form on our website. This will go on Facebook tomorrow. It has been sent to all of the schools. So the instructions on how to report a home test will go home with every test kit with the schools. And we do have our original method where you can call us with the results, or you can submit the online form. And that is all that I have. Dr. Williams?
Thank you, Julie.
Hopefully everyone can see my screen. So I'm going to start, as I usually do, with an update of national trends. So if you look at the new cases for the US, there's a very disturbing trend of very rapid increase in cases. And just to put this in some perspective, the 14-day average is more than 400,000 cases. If you look back to last winter when we were having a very difficult time, it was 100,000 cases. So very dramatic increase in a very short period of time. If you look at the trend summary, cases going up by more than 200%. Hospitalizations, which is of course what we care more about, are also up by 35%. This is nationally. And there's an increase in deaths as well. If you look at the hotspots, the Northeast and Midwest are certainly hotspots, but now unfortunately the Southeast has again become an area where the case rate is increasing dramatically. If you look at the nation and you look at our territories as well, what you see is there are 10 areas where the cases are going up most rapidly. And included in these are, I think we talked about Florida at our last talk, but a lot of these southeastern states are going up dramatically. They're going up in cases, but they're also going up in hospitalizations. And this, again, is the most concerning of these columns. So you have some states and territories where they're going up by more than 500% in a short period of time. If you look at New York State, it's a pretty similar story. And keeping in mind that back in the early days, we were looking at about 10,000 cases per day. than last winter when we had great difficulties. It was 16,500 cases per day. The other day we were at 61,000 cases in a single day. So really a dramatic increase. For the summary, again, cases up by more than 200%, hospitalizations up by approximately 74%, and deaths also increasing. If you look at the state and you look at hotspots, it's really right now the New York City metropolitan, sort of greater metropolitan area where the cases are going up incredibly rapidly. St. Lawrence County, if you see this scale, we're actually right now in a bit of a lull, which, as I'll talk about, I think is unfortunately going to end. To put things in perspective in another graphic, so this is New York State hospitalizations going up dramatically. St. Lawrence County and the North Country, though, are going down. So there's this lull that we've noticed in the past 2 or 3 weeks. I did want to, and Jolene presented the data looking at the percentage of people who are hospitalized who are vaccinated. I wanted to also just sort of underscore that really what we want to be looking at as well is the rate of hospitalization for people who are unvaccinated or vaccinated. And I would argue that this is very much the single best data point if an individual is sort of deciding, is a vaccine going to benefit me? This is data that's published. It's updated on the New York State site. This is the link to it. If you look as of the week ending the 20th of December, the rate of hospitalization for people who are unvaccinated is approximately 30 per 100,000. And if you look at the rate of hospitalization for people who are vaccinated, it was 2.1 per 100,000. So the bottom line is if you're unvaccinated, you have a 14 times higher rate or higher risk of hospitalization. And vaccinations as of that week were 94% effective at hospitalization. So I think this is sort of the most important point when we're talking about vaccine effectiveness. I want to shift gears and I want to talk about Omicron because this is really the new factor, the new variant that's driving a lot of what we're concerned about. So what is Omicron? So if you look at the COVID virus, it has these spike proteins. The spike proteins on Omicron have 50 different, well, they have 30 different mutations on the spike protein. There's 50 total new mutations that make up this variant. Omicron is absolutely driving all of those trends that I showed in terms of this really rocketing number of cases that we're seeing. Where is Omicron? So we are dependent a little bit on the CDC for their surveillance data. So they test specimens and they tell us, whether it's Omicron or Delta. However, their data is broken up by regions, and the HHS, the Health and Human Services Region 2 that New York State is in, also includes New Jersey. It also includes Puerto Rico and the Virgin Islands. So the data is relevant to us, but in some ways it's not as relevant. If you look at the graphic that they put out, all the orange bars, so this is week by week, and all the orange is Delta. So from September through the beginning of December, it was all Delta. Then in the first week or two of December, we started to see the purple, which represents Omicron. And with the last week that we had data for, Omicron was definitely the prominent variant that was present. But again, this is data from New York, but also New Jersey, Puerto Rico, and the Virgin Islands. For St. Lawrence County, we are fortunate in that the SUNY Upstate program through Quadrant Bioscience, they actually look at a number of our specimens and they're able to report whether, which variants are present. And starting in the week of between the 19th and the 27th, we did identify Omicron within the county. It was about a third of the specimens were from Omicron during that week. As far as Omicron, why should we care? So the biggest thing about Omicron is that it's highly contagious. It's much more contagious than Delta, which in turn was more contagious than the previous variants. And this table, I think, really demonstrates what happens when there's Omicron in a community. So this is from a site called COVID Act Now. And this is looking at the counties that have the greatest number of daily cases per 100,000. And what you see is like Nassau County, which had been at 25 cases per 100,000 a month ago, is now at more than 400. This again are mostly the urban areas in a different part of the state. You can see that St. Lawrence County, where we mostly have Delta, but that'll end shortly, we're all the way down in the 70 or so daily new cases per 100,000 for yesterday. If you look at a particular county that has Omicron, what you see is this just absolute rocketing number of cases. So it's the same thing as what we're seeing nationally, but we're seeing that in the counties in New York State where Omicron is clearly dominant. I wanted to just go over some frequently asked questions about Omicron. So probably the most important thing is, does Omicron cause less severe illness? And at my presentation last month, I said there was real question about this. I think there's more information now. And I can fairly confidently answer that the answer is yes, that it's less severe compared to Delta. And there are multiple studies now that are demonstrating that it doesn't cause as severe a disease. And part of what we're discovering is that Omicron tends to invade the upper respiratory tract. So it causes sinusitis, or it may cause a bronchitis, whereas Delta and the previous variants were much more likely to invade the lower respiratory tract and cause pneumonia and other complications. There was a very good article in the Journal of the American Medical Association where physicians in South Africa looked at patients with COVID who are coming to their emergency department and comparing them to people who had Delta or some of the previous variants. And what they showed was that only about 40% of patients with Omicron ended up requiring admission once they presented to the ER, compared to 70% of COVID patients with the previous variants. They also showed that less than 20% of these patients required oxygen therapy, whereas nearly 75% required oxygen therapy with Delta. And it was kind of the same ratio of people who needed to be mechanically ventilated. Admissions to intensive care unit was like 18.5%, where it was 30% with Delta. And the length of stay, so how long somebody stayed in the hospital after they were admitted for Omicron, was 3 days compared to 7 or 8 days with the previous waves of variants. And then finally, and probably most importantly, is the death rate for those who were hospitalized was 2.7% for Omicron, where it was almost 29% for Delta, which I should say is a very high death rate, but this is data from South Africa. So all of that is good news. Another question is, will the vaccines be effective against Omicron? And the answer is yes. However, I think it's important for people to realize that the possibility of breakthrough cases is reasonably high. So people who are vaccinated are still going to become infected with Omicron, and people who are vaccinated and infected can still spread the infection. So a lot of the public health measures we talk about take this into account. However, the primary role of vaccines remains to reduce severe illness requiring hospitalization. And there's now fairly good evidence that the risk of hospitalization for people who receive the primary series of the vaccine, so that would be 2 Pfizer doses, 2 Moderna doses, or 1 Johnson & Johnson, it's around 70% effective at preventing people from being in the hospital. And if people receive boosters, it seems to be somewhere between 88 and 94% if you review the literature. But the vaccines are going to work. Getting boosted is probably even more important than it ever was before. I think kind of another relevant question is, will prior infection and the associated infection-induced or natural immunity, will that protect people against Omicron? And I think the fair answer is that yes, it will, but to some degree. And there was a very nice paper put out by the Imperial College of London where they looked at how Omicron behaved in terms of being able to, it's called immune escape, where it can escape our immune system. And what they showed was that Omicron was associated with a 5.4 times higher risk of reinfection compared to Delta. And when they did their calculations, they felt that evidence of previous infection gave you about a 19% protection against being infected with Omicron. Now, this is against being infected. I think there's definitely evidence that prior infection, which gives you naturally induced immunity, does provide some degree of protection against severe illness or death, kind of in parallel to what we're talking about with vaccines. And some people are thinking that this may be a contributing factor to the low rate of hospitalization and death from Omicron that we're seeing in South Africa. Now, I do want to emphasize that the risk of relying on infection-induced immunity, there are risks involved, right? So people can get severely ill or they can die from the primary infection. There is a lack of predictable response, and there's also some technical difficulties in terms of validating whether someone had an immune response to the infection. So again, vaccination continues to be recommended as the safest and most predictable way to develop immunity, but I do think it's important to talk about, infection-induced or natural immunity. Another question: does Omicron cause more illness in children? And this is a difficult one, and I want to be careful about how I describe this. So, I think the answer is yes, there will be more illness in children, but not more severe illness. If you look at the data nationally, there's definitely pediatric hospitalizations with a diagnosis of COVID have increased significantly. I've seen numbers of gone up by a factor of 4 or gone up 66%. Definitely more children are in the hospital with COVID. It's important to realize that some of the children who are admitted for another reason. So they, break a bone and then they're tested for COVID and they're found to have COVID. They're not in the hospital because they're sick from COVID. They just happen to have COVID and they have another illness. Some of the people are sick with COVID, and that's concerning. I think, again, the high overall number of cases just across the board, anytime you have this number of cases, you're going to see an increase in hospitalizations across the board, including children. But there's no indication that the illness from Omicron causes more severe illness in children. As far as outpatient treatments for Omicron, so absolutely, there are outpatient treatments for Omicron. And molnupiravir, which is the pill from Merck, and Paxlovid, which is from Pfizer, everyone believes that they're going to be effective against Omicron. And if you remember, molnupiravir reduces risk of hospitalization or death by about 30%, whereas Paxlovid is about 89%. Both require a prescription, and there's limited availability. There are actually 3 pharmacies in the county that have been identified as distribution sites. So if you happen to see your provider and you need this medication, your provider is going to have to send the prescription for now to one of these 3 pharmacies. One of the challenges is with IV monoclonal antibody therapy, we've been using more and more Regeneron in the community, and we have a very effective system for getting that to patients who need it. The problem is there's a lot of data that shows that Regeneron is not effective against Omicron. There's another IV monoclonal antibody therapy called sotrovimab, which does work. The problem is it's in short supply. We do have some available at local hospitals, but it's going to be a challenge for us to have enough of it to provide to patients. And then there's a medication called remdesivir, which we've used in the hospital to treat people. There was a recent study that showed that getting 3 infusions, so that's 3 IV infusions, can reduce the risk of hospitalization by more than 80%. And then finally, there are ongoing trials. I've talked before about the Principal trial and the Active 6 trial, looking at repurposed medications, including ivermectin and fluvoxetine and other medications to see if they are effective and options for treatment. Another question is, will the current tests detect Omicron? And the answer is yes. mostly. The PCR tests and the molecular tests or NAAT tests that we do through the hospitals and the community testing centers, they do detect Delta or Omicron. They won't tell you that you've got Omicron or Delta. They'll just tell you you've got COVID, but they do that accurately. Antigen tests, which are the rapid, sometimes home-based, sometimes clinic-based tests, and they're the tests that Jolene was referring to, talking about what the students would get. The FDA issued a statement that said that the tests will work, but they may have reduced sensitivity. So they may have an increased risk of a false negative. Abbott, which uses the Binax card, which is probably the most common antigen test, and something called Quidel QuickView, they actually reported that they don't see any change in their performance. So I think the answer is yes, but we just have to be cautious. And then a kind of a summary question is, I'm giving some mixed messages. So if Omicron is less severe, should we still be concerned? And again, I think the answer is very clearly yes. So as you can see in these national patterns, I think we anticipate that there's going to be a dramatic increase in the number of infections throughout the community. Even if the rate of hospitalization is like 50% or 30% that of Delta, if we have 5 times as many cases, hospitalizations are going to increase dramatically and they may soar past local capacity. The other thing I'm concerned about is our local hospital systems really are not designed to take care of large number of pediatric patients. And if we're taking care of large number of pediatric patients, our regional partners will be as well. And we don't want to be in a situation where, where we're struggling for that population. So what can we do in the coming weeks? Not to sound like a broken record, but it's really the 6 pillars of prevention. So if you're not vaccinated, this would be a great time to get vaccinated. If you're not boosted, get a booster. Jolene is working with her crew to make these more available. Wearing a high quality mask indoors. I think it's really more and more clear that you want a high quality surgical mask or a KN95 or even an N95. If you're sick, stay home, wash your hands, stay local, and maintain physical distance if you're able to. So just to summarize, cases and hospitalizations are currently down in St. Lawrence County in the North Country, which is a wonderful thing. However, Omicron is spreading at an alarming rate throughout the country and New York State. And there's no doubt in my mind that we're in this sort of calm before the storm. Fortunately, Omicron can be detected by our tests. Severe illness can be prevented by vaccination. Infection can be treated by oral and IV therapies. And overall, Omicron, I think, is less severe than Delta. The sheer volume of cases appears, in other communities to cause a significant increase in hospitalizations. It's possible it's not going to cause a significant increase in death, which would be a blessing. It looks like the duration of Omicron is likely to be brief, but it's going to be intense. And again, I'm basing this on what's happening in other countries. And then finally, and maybe this is a silver lining, I think some people, myself included, feel that Omicron may, and I bolded that and italicized it, it may mark the transition from this being a pandemic to what we call an endemic disease. And I think it's a combination of, vaccination and also the background natural immunity, as well as this viral evolution where it's becoming less virulent. It may allow us a transition toward normalcy later this year. So that is my presentation.
Any questions of Dr. Williams? Ms. Curran?
So I have a number of people that call me and ask me about natural immunity and when are we going to start testing for natural immunity so we can pair it up and say, okay, well, this person had natural immunity and when they got this disease, these were their symptoms, so that we can have a better idea. I personally believe there's a number of people that are probably COVID infected running around whose disease symptoms are so mild that they don't really mind them and maybe don't go and get tested. And if we had some kind of an idea as to who was COVID antibody positive to start with, we might be able to get some better numbers on what our real survivability and percentages of infections such as that might be. I know that's an extra job for you, but there's a big interest growing in it, right? So,
Sure. No, I agree. I think there are a lot of technical challenges about measuring antibody levels, but it certainly is an important area of research.
and if I can, just another.
Yes, go ahead.
And don't forget, if you do get a lot of pediatric patients, there's a lot of us that have a lot of years of peds in busy city hospitals and still carry PALs and all that stuff that would help out.
Excellent.
Any other questions of Dr. Williams? Yes, Mrs. Haggard?
Thank you, Mr. Chair. Thank you for your presentation, Jolene and Dr. Williams. Dr. Williams, this is the scenario that I'm hearing about, and you tell me what the solution is. People are, like myself, I bought at-home tests to use before I gathered with family at Christmas time. People were sick. They took the at-home test. It was negative. They decided they would get online and get an appointment right away to get a regular test. And the right away part didn't work out. Are we falling behind in testing, the PCR testing, or was that just the Christmas crunch?
No, I think what's happening is the demand for testing has increased dramatically, and our capacity to do the testing hasn't matched that increased demand. It's not a matter of the machinery. It's essentially a matter of just having the people to do the swabbing and to collect the specimen. So before this meeting, I was on the phone with all the people who I'm involved with who participate in testing, basically saying we just have to increase capacity very quickly, because I think in the weeks to come, if what happens here is reflective of what's happened in the rest of the country, the demand is going to go up and up and up, and we need to meet that demand. And I will point out that there's some discussion about having a state testing site here. I think one of the challenges is we need to have testing that comes back within a short period of time. And I think testing that comes back much more than 24 hours is certainly less helpful. Now that we have medications available that are oral, that need to be given within 5 days, if you start having testing that comes back 2 days later, 3 days later, just clinically, your people are going to miss the window for treatment. And so as we think about options, we just need to keep that timeline in mind.
Thank you. That's encouraging that we're looking at ramping it up, because if it doesn't the way you're predicting, I hope that people can get tested. Thank you very much.
Legislator Terminelli.
Thank you, Mr. Chairman, and thank you, Dr. Williams and Ms. Munger, for your presentation. I definitely know that there are members of the community that very much look forward to our full board meetings and to getting these COVID updates. They enjoyed the weekly ones, and so they definitely appreciate these monthly ones now. I have a comment and a question. The first, just comment on the school, and I think I make this comment every month. I just want to make sure that the public knows that when we put up the school numbers, those are not necessarily transmission in school buildings. They're just positive cases. I just want to clarify on that because, you know, I work in a school and I know how hard we're working to make sure that kids are safe. And so I just want to put that out there, that those numbers don't necessarily reflect spread in school, but rather reflect positive staff or students. That's correct, right?
That is correct. We do still have school spread, not much. We do have some, and we are seeing more sports spread on sporting teams than we have before. We've got some clusters on some sports teams going on. We do have minimal spread in the schools, but most of that is an individual that is a K-12 student or works at a staff, just same as the colleges. The individual goes to a college or works for the college. Those are the ones that are included in the weekly, the K-12 numbers in the colleges.
Okay.
And Legislator Terminelli, if I could just add that I think one thing we have learned is that school remains one of the safest places for school children for all kinds of reasons, but even from a COVID perspective, if a school has implemented the mitigation measures that we've asked them to, it's one of the safest places for those students. I think a lot of the transmission occurs outside of school to school age people.
Great, thank you for clarifying that, because I do agree. I see the safety measures that are in place firsthand. And then the second one, Jolene, for the community clinics that are coming up, do those need to be appointments made either through the Facebook links or through our county website, or are you allowing walk-ins for those?
So we're for first and second doses, because that is always a priority if somebody, you know, makes that decision. We're allowing walk-ins. The volume with those is less though, so it's for booster doses, which are the high demand. We are requiring pre-registrations, and that's for a couple of reasons. We have limited staff that are going to the centers, and we have limited space and supply when we go out to them. So it gives us a better idea of controlling the number of people. You don't have to wait. We're pretty efficient right now. So when you come in for your appointment, you're in and out in about 20 minutes because you have your 15-minute observation period, and the whole, you know, registration to get your shot takes about 5 minutes for us at this point in time. So we do require pre-registration for boosters, and you can also pre-register if you would like an appointment for first or second doses.
Okay, great. Thank you so much.
Legislator Forsythe. I'm all set. Okay. Legislator Akers.
Thank you, Dr. Williams and Jolene Munger, for your presentation. Lots of data and very transparent. I want to thank you for talking about natural immunity. When I'm talking to constituents, they bring up the topics of masks, to talk about natural immunity, and they also talk about people that are vaccinated actually still being able to spread the virus. So you broached on all three of those subjects, particularly on the cloth mask. I think it was evident in Jolene's presentation that really the N95s are the only mask, at least this is how I interpret it, to be an effective protection against the actual virus itself. N95 masks are on the bottom scale of respirators, and so they just barely qualify for that. And so I think that we can encourage people to use the N95 mask versus the ones they made at home or they picked up out of the box. I think the county has 40,000. Many of them have been distributed. Do we still have many to go? Ruth?
Mr. Chair, can I answer that?
Yes, go
Can I
ahead.
say,
Ruth.
we do have some and we've requested more.
Okay, so that's great. And I think what's been dividing this for just the nation and St. Lawrence County is you know that this has actually been a pandemic of the unvaccinated. Well, that may be partially true. We know that people that are vaccinated are being vaccinated or are vaccinated are actually getting the virus too. One of the things that I think will be contentious now is that New York State and the CDC is talking about the quarantine period of 5 days versus 10. And so the definition of who is actually an essential worker, I think, is going to be very subjective and actually a cause for division. It seems to me that if someone has been quarantining and it's 5 days for a healthcare worker, and the healthcare worker still has to wear the mask and has to be not feeling ill, that should also qualify for any other worker in this economy. And I think that'll be the next challenge. The other thing, the Paxlovid, I know that in our public health meetings, we discussed about how much more effective it is, and then actually about how the Merck product is a little bit more dangerous possibly. Do you see a point in time when Paxlovid will be available to the general public? Maybe not in the, I think what would happen if it became available and doctors have a larger supply, that consumers will be tempted to actually purchase this and have it in their medicine chest, much like Tylenol or something else, and that the product itself would be improperly applied.
So that's a good question. I think the challenge with Paxlovid, which, as you mentioned, is a more effective medication, is that just the nature of the pharmaceutical, it interacts with multiple common prescription medications. And so you really need the knowledge of a provider, a physician or nurse practitioner, or PA, and sometimes a pharmacist to make sure that the medication can be safely taken. The medications it interacts with are fairly common, and there also tend to be the medications like blood pressure medicines or cholesterol medicines that a lot of the target population is likely to be. So these medications are most beneficial in people who have hypertension, who have obesity, and may have hypercholesterolemia. Those patients are on these medications that Paxlovid interacts with. So unlike other medications, like for, PPIs for reflux that have become over the counter, this is a particular medication that would probably never really lend itself to over the counter non-prescription availability, unfortunately.
The other thing we talked about in the public health meeting was about the efficacy of the actual COVID pills themselves. And that is finding out if you're actually sick and thinking, well, maybe it's just a cold. And then actually you're 1, 2, maybe 3 days actually into a COVID diagnosis. And you don't really know. That's a challenge. How are we going to overcome that challenge for, some of it is through rapid testing, but since the time that we met there on the 22nd, maybe come up with an answer, Dr. Williams.
So it's a double challenge because as we alluded to in the first question, you need a provider to be involved in this process, and you need a test. So now not only do you have to get an appointment to get a test done, you have to get an appointment to see a provider. So the medical community is working on this. One of my meetings tomorrow is trying to figure out how in St. Lawrence County we can make this as efficient as possible, because it may be you may or may not be able to get a test done within that period of time, but to get a hold of a provider and to get the prescription and to pick it up from the pharmacy is another challenge. So we're going to work really hard to make this available in St. Lawrence County, because it's very important. It's a 5-day window. And that gets back to the whole issue of testing, where I don't want us as a county to ask for help from the state only to get tests that come back in 2.5 days. Now, if they can do it in 1 day, that's great. I think the antigen tests are considered legitimate. If you have a positive antigen test, that is considered acceptable for a prescriber to choose to prescribe the medication. So getting more of these point of care antigen tests will be very important.
Thank you very much, Dr. Williams.
Any other questions? Yes, go ahead, Mr. Burke.
So, Dr. Williams, you said that, I guess I'm wondering what's the hierarchy of need here as it relates to getting tests that are accessible and have a quick turnaround. But is it only the hospitals that are working on this? I guess I'm wondering, is there anybody interfacing with I assume our public health department is, but interfacing with the state, and what requests are being made of them?
So I can speak to that a little bit. We are working so all requests for state assistance go through the New York response system that the state has set up, and that is through emergency services. So we work with Matt Denner to put all of the requests in. So right now we are working potentially on identifying a county site that might work for it. But as Dr. Williams said, once we find the site, it's also identifying the type of testing that would be beneficial to the county to have the turnaround time that would be needed to have that to increase the testing capacity.
Thank you.
Does that answer your question, Mr. Burke?
Yes. Yeah.
Okay, so all the questions that there are for Dr. Williams and Jolene Munger. Thank you very much, Doctor. Thank you, Jolene.
Thank you.
Thanks, everyone.
Okay, we do need a motion for the approval of the minutes for December 6th and December 20th. Mr. Kern, Mr. Perkins makes a motion, second. Any discussion? All in favor? Opposed? Carried. Communications?
We have one. A letter was received from Andrea Montgomery, Director of Office for the Aging, thanking the members of the board who contributed to the holiday gift drive for older adults. The generous donations were greatly appreciated and helped to improve the quality of life for older adults.
Thank you. Next is citizen participation. Anyone who's wishing to participate, come to the podium and state your name and your address. And you've got 5 minutes. And the first person I was going to call was Bill Shumway, and that is you, Bill.
It is.
How are you?
Chairman Sheridan, county legislators, thank you for the opportunity to address you tonight. As we mentioned, I am Bill Shumway, editor and publisher of North Country This Week and NorthCountryNow.com. North Country This Week is the only St. Lawrence County owned newspaper, and we've been serving the area continuously for 38 years. We are requesting St. Lawrence County change the way official newspapers are selected, so taxpayer dollars are invested where the most citizens will see required legal notices. In 2020, North Country This Week created a paid St. Lawrence County edition sent by the U.S. Postal Service via second-class mail to meet state requirements to accept legal notices. We did that in response to a number of requests from village, town, and school officials, as well as several county department heads. They were frustrated because few of the residents they served saw the legal notices they published, because those residents didn't subscribe to the newspaper in which those legal notices appeared. Designating North Country This Week as the primary official newspaper for St. Lawrence County will address that issue, because 6 times as many people read North Country This Week as any other newspaper in St. Lawrence County. Whether the county is seeking the best bid for a construction project or notifying citizens of a public hearing for a proposed new law that will soon be voted on, it's important that legal notices be seen by as many people as possible. North Country This Week, with 3 different editions, meets that standard. Our legal rates are nearly identical to the other newspapers, and yet, as I mentioned, about 6 times as many people read our paper as any other newspaper in St. Lawrence County. At no extra charge, we print legal notices in our popular free editions, and we also post them at no extra charge on NorthCountryNow.com, where they can be seen by everybody throughout the county. No subscription is required. By choosing North Country This Week, you would also provide a much needed shot in the arm to an organization that has taken a blow from the pandemic, but has not sought assistance from local economic development agencies. Our paper has provided free publicity and news coverage for community groups, governments, nonprofits, businesses, schools, churches, and other organizations for decades, while providing livable wages to our employees. A reliable revenue stream from legal notices can help us continue to provide those services in years to come. Thank you for your consideration. On behalf of our 20 employees who live throughout St. Lawrence County, I hope you all agree to designate North Country This Week as St. Lawrence County's primary official newspaper. Thank you again.
Just one person on the list?
Yeah, but there may be others.
Good evening. My name is Rachel Raven. I'm with the Child Organization, and I'm from Governor, as you may recall. As we reflect on 2021, I want to reflect on child's voice here in the legislative meeting. Now for the last 8 months. Now for the last 21 months, we've been collecting data from community members in regards to child and issues, ongoing issues and consistent issues that we've been documenting in regards to CPS. For 17 months, our child organization has been an LLC. I want to propose that child, specifically Courtney Fantone, our director, is given an opportunity to speak or to formally present at board meetings when the board routinely meets with department heads such as the CPS department, so that Courtney can provide data that we've collected, tangible examples to the board so that proper decision-making can be made. This would allow us to have a voice in a very professional, organized, and fact-based discussion around matters at hand. This would effectively and efficiently allow community members and child to feel heard. Child is not seeking to point fingers, to call names, to mudsling, to get political. Child is not seeking to respond emotionally or shift the blame or sabotage others' careers. Rather, we want to be part of the change. We want to present the information and the facts that we've collected. I know that in the recent months, I think it was last month, Dottie presented a ethical concern that was discussed here at the meetings. A copy of an email from a CPS worker. This is one of many examples, tangible examples that child has collected. And if you read the letter I submitted last month when I couldn't be here in person, you would see the example that I provided of a community member that was interviewed by CPS 13 months after she reported her concerns. And it was logged on the New York State hotline that she had for her 15-year-old grandson. And again, I'll restate that, 13 months later, this lady got a call from CPS asking for a formal interview to further discuss the situation. That echoes the incidences in Triana, Somerville. But fortunately, this child did not have the same result. But these are policies and procedures that are not being followed through with. And we want to present this information to anyone willing to hear us. I appreciate and I know that the St. Lawrence County Legislature is contracted with an outside third-party agency to hear our voices and to investigate further. I have yet to be contacted, but I do appreciate that effort. But I think Courtney Fantone's presence and ability to formally provide the data would also be of great help. Many of our families, such as myself, are 3 to 4 years into dealing with these mishaps that have sabotaged our family units. And so I just want to continue to echo that, continue to be their voice. And I did get Christmas with my children. New Year's wasn't considered a holiday, but I did get 6 hours. And for some of you that know my story, that's the first Christmas in 3 years. So I thank the Lord for that. Thank you.
So, for citizen participation. Mr. Akers, do you have a resolution?
And I offer for adoption, the adoption of the rules of procedure. I move this resolution.
Seconded by Ms. Akers, excuse me, second by Ms. Kern. Would you see Mr. Perkins, you have your hand up? Sure. And Mr. Perkins. And all in favor? And who would like, Mr. Lightfoot, are you up to presenting the resolution? And would like to have Larry, Tanisha take care of that for you. Mr. Lightfoot?
Yeah.
Would you like to present these resolutions, or would you like to have someone in the chambers do that for you?
Your voice is not clear enough for me to understand what you're saying, Bill. I'm sorry.
Can you hear me better now?
Well, I can hear you, with those words, yes.
Okay, did you want to present your resolutions, or would you like to have someone else in the chambers do that for you tonight?
No, I would be happy to present them. And the first resolution is authorizing the chair to sign the 2022 annual update and plan for funding from New York State Office for the Aging, and I move for its adoption.
Seconded by Mr. Denisha. All in favor?
Aye.
Any opposed? Carried. Go ahead, Mr. Lightfoot.
The next resolution is modifying the 2021 budget for the Public Health Department Coroners Program, and I move for its adoption.
Seconded by Mr. Fay. Any discussion? No discussion. Roll call, please.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
15 yes.
Motion carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for social services for transportation costs related to first and move for its adoption.
Seconded by Mr. Forsythe. And any discussion? No discussion. We have a roll call, Kelly.
Sorry, my computer's not coming up right yet. It's taking a minute. Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
15 yes.
Resolution carries. Ms. Curran.
Thank you, Mr. Chairman. I have a resolution accepting the fiscal year 21 community-oriented policing services office hiring program grant from the Department of Justice and modifying the 2022 budget for the sheriff's office. I move that resolution.
Seconded by Mr. Smithers and Mr. Denisha. Any discussion? No discussion. Could we have a roll call, Kelly?
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
15 yes.
Resolution carries. Ms. Curran.
Thank you, Mr. Chairman. I have a resolution modifying the 2021 budget for the Sheriff's Office for overtime, and move that resolution.
Seconded by Mr. Smithers. Any discussion? No discussion. Roll call. Kelly?
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins.
Yes.
Akers.
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
yes,
Burke,
yes,
Arquette,
Yes.
Terminelli,
yes,
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
yes,
15 yes.
Resolution carries. Ms. Kern?
Thank you, Mr. Chair. I have a resolution authorizing the chair to grant a federal equitable sharing program agreement and annual certification report for the Sheriff's Office for the year 2021, and move that resolution.
Seconded by Mr. Smithers. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern?
Yes, thank you. I have a resolution authorizing the chair to sign contracts and establishing a school resource officer SRO program for school districts in St. Lawrence County, and move that resolution.
Seconded by Mr. Denisha. Discussion? Go ahead, Mr. Forsythe.
Yeah, I just have one question for the sheriff.
Sheriff on?
Here he is. Oh, there's some.
There's Sheriff Bigworth.
Thank you. Sheriff, I asked at the last one, what was the reasoning behind like a retired correction officer or something could not be an SRO? Yeah.
It's under the civil service rules of qualifications that they don't qualify because they're not a police officer, they're a peace officer.
So they're a peace officer as opposed to.
Correct.
Go ahead, Mr. Denisha.
Thank you, Mr. Chairman. Really glad to see this resolution come before the board. We started discussing this about 3 years ago. And you know, at the time, there was interest, but we weren't really sure how to proceed with it. And I think it's very important that we do this because, and I've said before, although we're somewhat isolated in St. Lawrence County, we're not immune. And I think it's an opportunity for us to be proactive. And I think it's certainly in favor of this resolution.
Any further discussion? See no further discussion. All in favor of the resolution?
Aye.
Opposed? Carried. Ms. Kern?
Thank you. I have a resolution authorizing the chair to sign a contract with Volunteer Transportation Center, Inc. for the first mile, last mile services, and I move that resolution.
Seconded by Mr. Smithers, Mr. Denisha. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern?
Yes, I have a resolution authorizing the chair to sign a one-year contract extension with Volunteer Transportation Center, Inc. for the transportation services to COVID-19 vaccine sites, and move that resolution.
Seconded by Mr. Smithers. Any discussion? See any discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern?
Thank you, Mr. Chair. I have a resolution authorizing the chair to sign a contract with OptiMed Health Partners for infusion therapy services, and move that resolution.
Seconded by Mr. Kevin Akers. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern?
I have a resolution for the adoption of a revised Family and Medical Leave Act policy for St. Lawrence County, and move that resolution.
Seconded by Mr. Perkins. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern?
Thank you. I have a resolution proclaiming, recognizing, the 100th birthday of Miss Agnes Emma Landon Woodrow, Mr. Denisha's sister. And I move this resolution.
Second by Mr. Denisha. All in favor?
Aye.
Oh, excuse me, how about discussion? Discussion? No discussion? Yes, go ahead, Mr. Denisha.
Thank you, Mr. Chair. Agnes Woodrow, fondly known to most folks that know her is Aggie. And Aggie Woodrow has been a fixture in the Herman area for years. She's a great lady. She's contributed a lot to the community. She's always been there whenever she was needed. And I'm certainly pleased that she's going to receive this honor. And I'm going to present the plaque to her Saturday at the Herman Fire Hall. We're having the community's having a birthday party for her. Wonderful.
Any other discussion? No one else knows Aggie? Tell her I said below.
I will.
Okay. All in favor?
Aye.
Opposed? Carried. Ms. Kern.
I have a resolution supporting the expansion of broadband infrastructure in St. Lawrence County and move this resolution.
Seconded by Ms. Haggard, Mr. Manelli. And discussion on that. There's no discussion? Okay, all in favor?
Aye.
Opposed? Carried. Ms. Kern.
Thank you, Chairman. I have a resolution opposing the adoption of the New York Wage Board recommendation, decreasing the overtime threshold for farm workers from 60 hours to 40 hours per week, and I move this resolution.
Seconded by Mr. Perkins. And discussion. Mr. Akins.
Well, I wholeheartedly support this resolution. I think people are aware that farmers have been under a lot of stress for a number of years. Commodity prices, if you're in the business of producing commodity, you're subject to supply and demand and weather. Particularly in the ag industry, when we go and we lobby as a Farm Bureau member to our New York City friends and legislators down there, they always ask us, well, why? Should they be denied overtime benefits versus someone who's working a regular 9-to-5 job? And it's the old adage, when the sun shines, you gotta make hay. And it truly is that situation, that we're subject to the variances in the weather. You could have 3-4 days of rain and then maybe 5 days of sunshine. And in those 5 days, you have to put your crop in. And here, if you're in the dairy industry growing corn or grain, a lot depends on the timeliness of when that crop is actually implemented. And, and if you don't make it, if you don't get your corn in by the middle of May, you're going to be behind. The corn itself will have lower energy value, which then the cows won't milk as well like that. But on a larger standpoint, I think for all of you that are buying groceries, what you're finding is that most of your fruit, almost 100% of your fruit and your vegetables is picked by migrant labor that travels up the East Coast as the crop ripens, that they're picking that crop. And so they're here, they're going to work here for 6 months, and then they're going to go back home, maybe home to their island or whatever. And they're going to live the rest of their 6 months at home with their families. If they come to New York State, they're here to work, and that may be 60, 70, 80 hours on their own time, as far as getting paid for that. They're here to work. They're not here to sit around after 40 hours. So they're going to stop at the border in Pennsylvania. They're going to stop in Ohio. They're not going to come to New York to pick peaches in Western New York if they're subject to 40 hours. And the difference between a peach that is on the tree and then one that's on the ground is about 10 cents on the dollar. So I think that the state legislature is well aware that we're getting lots of publicity on this, but it's a New York City controlled legislature down there in Albany. So there's real implications. So we would appreciate any support by the community in reaching out to any legislator in Albany and actually promoting this. It's not the 40 hours, it's about whether or not we'll have food available for tables here in New York that is actually generated in New York rather than outside, whether it's China, Ohio, Pennsylvania, or whatever. It's very important that this overtime threshold is not lowered to 40. California has 60 hours, it works for them. Just about all your vegetables, all your salads that you're eating today are coming out of California, from that area. So I urge everyone to support this resolution.
Any further discussion? Being no further discussion, all in favor?
Aye.
Opposed? Carried.
No.
Who voted no? Was that Joe voted no?
He said something, I'm not sure what. He said no.
Joe?
Lightfoot said no.
Lightfoot said no, okay. One no vote. Motion carries. Ms. Kern.
I think the next one is Mr. Akers.
Oh, excuse me, Mr. Akers?
I'm sorry.
Thank you, Mr. Chairman. I offer a resolution for modifying the 2021 budget for the Department of Highways for equipment repair and maintenance, fuel, and materials. I move this resolution.
Seconded by Ms. Kern. Mr. Smithers, any discussion? No discussion, roll call vote, Kelly?
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Hay,
Yes.
Haggard,
Yes.
Diaco.
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
15 yes.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution for the use of county-owned machinery. I move this resolution.
Seconded by Mr. Smithers and Ms. Kern. Any discussion? Seeing no discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for correcting and refunding erroneous taxes. I move this resolution.
Seconded by Ms. Kern, Mr. Perkins. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for real property for equipment repair and maintenance. I move this resolution.
Seconded by Mr. Smithers. Any discussion? No discussion. We have a roll call. Kelly?
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Hay,
Yes.
Haggard,
Yes.
Diaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
15 yes.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing blanket bond in lieu of individual sureties for county officials and employees. I move this resolution.
Seconded by Mr. Perkins. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing petty cash accounts and departmental cash drawers. I move this resolution.
Seconded by Ms. Kern. And any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for bank depositories and investment county funds. I move this resolution.
Seconded by Mr. Vice Chairman, Mr. Larry. Go ahead. He seconds it. Is there any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution encouraging the Public Health Department not to issue fines for violations of the Department of Health Regulation 2.600 mask mandate, and move this resolution.
Seconded by Mr. Kern. Any discussion? Yes, we have Mr. Burke for discussion.
I won't be supporting this. I think it's an overreach of our authority. You know, we listened to the reports offered by Jolene and Dr. Williams. They're very capable people in our public health department and on the board. I think we should let them do their job without any kind of political interference.
Mr. Akers.
So this resolution, which I brought forth, is in response to what I think has been a little bit of hysteria about this. And I think that businesses have been under enough pressure. We've heard tonight that we still have a differential about who is actually essential. So just on the 5 days versus 10 days quarantine, which 5 days difference is a week's worth of work in many cases. And it has severe economic problems with that. And I think that by doing this, it's not encouraging people not to wear masks. It's not encouraging people not to get vaccinated. It's basically encouraging the public health not to issue fines. Now, it's been made in the past comments by Mr. Burke that we have not issued any fines. That is true. That's not to mention that our county attorney has been taking calls in the past about people basically calling in about businesses that are not enforcing the mask mandate, or they're seeing individuals not wearing a mask in a private business. We've been through enough. The vaccines have been widely available. People have made up their minds about whether the masks are effective at night or not. We've heard tonight that the N95 could be a better source, or is a better source than a cloth mask. This is all this is. I think this is an overreach on the part of the New York State Department of Health to further enforce another unfunded mandate on the public health. We don't have the resources to do so. And regardless of whether or not we have issued fines in the past, the regulation says they can't. This is encouraging them not to do so, and that is it.
Any other discussion? No further discussion. All in favor?
Aye.
Opposed?
No.
Motion carries. Mr. Akers.
Mr. Chair, I offer a resolution authorizing the chair to sign contracts. I move this resolution.
Seconded by Mr. Kern. And discussion? Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, this resolution is tabled. Is the proper procedure that I read this off, or we ask for its removal from the table?
You just asked for it to be removed. We can all see what it is.
So I would ask that this resolution, which is titled amending resolution number 17-2021, quote, newspaper designation rotation schedule, I would move for it to be removed from the table.
Okay, it's been moved and seconded by Ms. Kern, and who else seconded it? Mr. Forsythe seconded it as well. Okay, any discussion? Mr. Reagan.
Thank you, Mr. Chair. I think that Bill Shumway made a terrific presentation tonight, and I hope everyone in this room will join me in reforming a antiquated and outmoded system that does not serve the needs of the people of St. Lawrence County. As Mr. Shumway said, North Country this week is serving 18,991, about 19,000 people. What I would like to see done is for us to consider reforming this system once and for all to do what's best for everyone in the county by getting our legal notices in front of as many county citizens as we can. And there's a simple way to do that. There's no reason in the world why we cannot designate North Country This Week as one of our newspapers, designate the Johnson newspapers, which together have about 5,000 subscribers in St. Lawrence County, and the Governor Tribune Press, which has 2,000, in order to reach as many households as possible, in order to make sure that when we issue legal notices, when we are advertising for our departments, that as many people as possible see them, and that this, system in which all the legal advertising goes to one community or another community every couple of years, that really isn't serving the public. It's not serving the people who elected us. And I believe that we could authorize the county administrator to negotiate a deal with North Country newspapers, the Johnson newspaper group, to give us the same kind of flat rate that they give Price Chopper, that they give other companies that are trying to reach the maximum number of households in the county. So I would like to move to table this again until we have an opportunity, the county administrator has an opportunity to see whether or not they're amenable to giving us the same kind of arrangement that they routinely give to their major advertisers on an annual basis, so that all of our county newspapers can be supported, so that all of the employees who are working on behalf of these companies will continue to have a job into the future. As Bill has told you, North Country This Week employs 20 people all around the county. Johnson Newspapers has a printing plant in Messina and prints publications from both St. Lawrence County and elsewhere. It brings in money, it brings in revenue, it brings in, it keeps jobs in St. Lawrence County. The Governor Tribune Press has a long, proud history of serving the people of St. Lawrence County, the people of Governor, and none of the other newspapers serve that same audience that the Tribune Press serves. So I would strongly urge everyone to, I know this is an arcane issue, it's something that most of the legislature never thinks about, hasn't thought about, and isn't, it's not something that they care deeply about. But it's important to a lot of families in this county, and it's important to our responsibility to keep the public informed about what we're doing.
So that's in the form of a motion.
Yeah, it's just a motion to table until next month. And meanwhile.
And Mr. Denisha, do you second that?
Second.
You second it as well?
I think it's a great idea.
Any more discussion?
No discussion.
There is no
No
discussion.
discussion on it.
No.
All in favor?
Aye.
Opposed? Carried. Straight.
Another resolution that's tabled, and I will make a motion to remove this resolution, which is titled newspaper designation, to remove it from being tabled.
Seconded by. Anyone second it? No second? So stays removed.
Is on the table.
It's on the, it's
Stays on the
back
table.
on the table. Okay, it's on the table. And that's all we need to do with that. All right, Mr. Akers?
Mr. Chairman, I offer a resolution urging New York State to compete and set up the Enhanced Federal Medicaid Assistance Program, known as EFMAP, reconciliation from last year, and to compensate St. Lawrence County according to federal requirements. I move this resolution.
Seconded by Ms. Kern and Mr. Smithers. Any discussion? Mr. Akers?
I would ask that our county administrator, Ruth Doyle, comment on this and how this money was not sent to us by the state.
Go ahead, Ruth.
So these funds were held onto by the state as a pass-through from the federal government. And NISAC, our lobbying organization, worked with counties at the last couple of conferences to, one, begin to identify, which I believe 17 or 18 counties at this point have foiled the information from New York State, given their notice that they would have to wait, and slowly been provided the information. I believe I shared at committee with you the total outstanding at this current time, and the request is with our amounts there that the state release these funds, not only to our county, but to all counties.
If I may. So essentially, New York State has had this money from the federal government from this period on here for St. Lawrence County of about $4 million. And we have not received these funds. And New York State is using this money for what? To build up their pension funds, investing it outside. We've not received this money. I did notice that in the be it further resolved who this was being sent to, and I asked that Congressman Elise Stefanik be included.
And that can be done.
Yes.
Okay, so. no
Friendly
Congress-
amendment.
Congress will be added to it. Any other discussion? All in favor of the resolution?
Aye.
Any opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution modifying the 2021 budget for the county clerk's office for a license plate cutter for the Department of Motor Vehicles. I move this resolution.
Seconded by Mr. Kern. Any discussion? I don't see any discussion. If someone is on the screen that wants to talk, just wave their hand and. No way, okay. Roll call.
Perkins,
Yes.
Akers,
Yes.
Hay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
No.
Sheridan,
No.
Smithers,
Yes.
Denisha,
Yes.
13 yes, 2 no.
Motion carries. And Mr. Drake, as well, present this resolution.
Yes, I would. Mr. Chairman, I offer your resolution for authorizing the chair to sign an agreement with the towns of Fraser, Norfolk, and Messina related to a public service law, Article 10 proceeding, recommending the issuance of a certificate of environmental compatibility and public need to construct an industrial scale solar generating facility. I move this resolution.
Seconded by Mr. Forsythe. Any discussion? Mr. Akins.
So I would ask for clarification. We're still reading, I believe I read it in North Country this week, about, or the Watertown paper, 1 and 2, about basically the environmental concerns. I would ask that Mr. Button illuminate the board on where they are in this matter.
Certainly.
Go ahead, Mr. Butler.
Thank you. As I indicated the last time this resolution arose, there are concerns that have been raised by the DEC associated with wetlands within the designated area in which Northside Solar wishes to develop. The resolution authorizes the chair to sign a document that indicates that for the county's purposes, the county's consideration has been met, but the DEC's consideration has not yet. There is a hearing that is being scheduled to move forward. They will be presenting testimony associated with that hearing, both the DEC as well as the applicant. So the siting board still has to determine, based on the differences between what the Northside Solar Group has presented and that which DEC has presented, which side will ultimately prevail and whether or not they will issue the certificate for the creation of that location. I have seen the rebuttal testimony that was put forward by the Northside Solar. They raised some very interesting points regarding the designation of certain portions of the wetlands in the areas that are designated for development. They contest quite fervently the position that the DEC has taken, which is that there are significant portions of wetlands within the development zone. I cannot tell you how the siting board is going to come down. What I can say is that the towns and the county, from a legal perspective, and talking to Mr. Bowich, who has been involved with this, as well as Mr. Gustafson and Mr. Linden, from our perspective, in terms of our regulations, they have complied. As for whether or not they have complied with the DEC, we can't say, and that's going to have to be the siting board that decides that.
So I think the issue for me is if the county approves this resolution, does that put the thumb on the scale in further environmental matters?
No, and I'll explain why. At one point, Northside Solar was actually looking for the prospect of the towns and the counties actually introducing testimony in favor of the Northside development. The towns and the county, at least from a legal perspective, were not comfortable with advocating for a position that would put us at odds with the state. The position we are advocating for is one that is a centrist road, which is we have reviewed it according to our own requirements, and according to our own requirements, we are willing to issue the certificate, but the issue of the environmental impact still must be resolved by the siting board. So by approving this resolution, by permitting the chair to go ahead and sign this, you are not taking a position that is in opposition to the state. You're not taking a position that is in support of the state either. You're taking a neutral position with respect to that.
Thank you, Mr. Butler.
Any further discussion? No further discussion. All, or somebody else? Yes, go ahead, Mr. Burke.
It would be interesting knowing just what, on one side of the equation, you hear that we shouldn't be using any kind of prime agricultural land for solar development, and I certainly agree with that. But I wonder what kind of land they plan on using. I mean, if you take out agricultural land and you exclude that, and again, I'm certainly don't want to go up against the environmentalists, but I took a tour of that land, and I think Tony did too. This isn't prime land, and I guess there was a report just recently that in order to meet the goals for energy independence or clean energy independence, that up to 25% of the land in the lower 48 states would have to house solar panels. And I guess I'm not asking for any consideration other than posing the question that where do we put these things? If we can't, if we can't put them on marginal lands, where do we put them? Don't expect an answer. Just again, rhetorical question.
Okay, any more discussion? Mr. Forsyth.
John, I see where you're coming from. I've said for 25 years, we gotta be the greenest county, one of the greenest counties in the country. When you add up all the hydro dams and the power that we produce already. And you're right, where are we gonna put it? And the discrepancy on this has been how much of it's wetlands opposed to not. I keep trying to think if it was with an RDRDA or was it here that we helped fund a drone, and I think it was Stu that has it, that can go on the topography of the land for like 1 inch. So it's the disparity or the discrepancy in the wetlands seems like that could be figured out pretty quickly by however fast they can drive that drone. So I really don't see the issue one way or the other, but I do say we're the greenest spot ever. So I think it should be proportional to the area.
Any other discussion? No other discussion. All in favor?
Aye.
That is hand.
Wait a minute, somebody had to clean up? Yes, go ahead, Mr. Perkins.
If I could ask the county attorney, in the last, now therefore be resolved, it says recommending the issuance of a certificate of environmental compatibility and public need to construct an industrial scale solar generating facility. So have we done an environmental compatibility?
No, that the main document that the siting board would be issuing is that document. It takes into consideration a number of different things. That's the main title of it, but it takes into consideration the impact of the localities, the municipalities. It takes into consideration the environmental impact, which the DEC speaks to. The Corps of Engineers can speak to if there is impact to a federal waterway or waterway that acts as a tributary to a federal body. So that's the main title of the document, but there are a number of different facets that go into it.
So these wetlands that the DEC is concerned about, we're asking to go ahead even though there's an issue?
No, what we are doing is indicating that we have no issue with the localities or municipalities' impact. It is the DEC that has raised an issue with respect to their jurisdiction, which is the environmental component. They are going to hold a hearing on the environmental component. If you'll give me just a second, I can tell you when that hearing is set. January 24th.
Thank you.
January what?
January 24th is the day of the hearing that the siting board has set with respect to the DEC's concerns.
Thank you. Any further discussion? Yes, Mr. Arquette, go ahead.
Thank you, Mr. Chairman. I think that unfortunately, we're all aware that we're one of the worst states in the nation to create new business. And the regulatory process is primarily the obstacle that we face. This is another example. As John put it, this is not prime farmland. And even if it was, it's land that's privately owned. An investment has been secured. People are looking to move forward, yet we're being hindered once again by the regulatory process. So I fully support this resolution, and I hope that the rest of my colleagues will do the same.
Any further discussion? Mr. Akers?
Just for the record, The reason that the solar farms are being developed here and there, we've lost 200 acres near my farm. That's actually was tillable land that's being turned into solar. And the reason it is because there's a mandate from the state coming out of Albany that basically 50% of our electricity be created from regeneration or renewable sources of energy by the year 2050. So what you have right now is the system that we have in place. You've got water flowing through the power project in Messina that is not being utilized to turn turbines to create electricity in order to actually take in the electricity from the windmills and the solar farms that are coming on, which are taking up tillable ground. And the reason is because our grid system infrastructure can't handle it. So when the wind's blowing or the sun's shining, and that's coming onto our grid, they meter down the hydro at the dam, which is so totally foolish. So here we are utilizing our very limited, finite resources of tillable ground here in the world, in New York State, and here in St. Lawrence County, for these purposes, which are being dictated by a mandate coming out of Albany. So that's why these are being cited.
Yes, go ahead, Mr. Worthington.
And don't forget, we have probably the last cheapest land in the country. So that's another reason.
Any other discussion? You ready to vote? All in favor?
Aye.
Opposed?
No.
One, Mr. Perkins, opposed. That's it? One opposition. Motion carries. Mr. Burke.
This resolution was tabled, and it's authorizing the exemption of sales tax on home heating fuels. It was tabled, and I would ask that we leave it tabled until Steve can give us some kind of a path forward for us to consider, if the board so chooses, for removing the sales tax on home heating fuel. It was clear that we were too late for this year. And, you know, and Steve has obtained some information and could probably give us a path forward if the board chooses to pursue it for another heating season. So I would ask that it remain tabled if it's the pleasure of the board.
That motion is on the floor to retable it. Is there a second?
Just take no action.
Just leave it.
Just leave it? Okay, and Mr. Button, would you like to address?
I'd be more than happy to if you'd like me to. At the last time that this motion was actually made on the floor, a question was posed to me as to what the process was, what the impact was, and what flexibility this board had with respect to granting an exemption with respect to sales tax imposed upon home heating fuel sources. The board does have a degree of flexibility and discretion with respect to doing this. But I reached out to the Department of Taxation and Finance for the state to identify the process that would have to be employed in order to enact this type of exemption. What they advised me of in the initial response back was that the process is very similar to the enactment of the 1% additional sales tax extension. I think you all recall the process that we had to go in with respect to that. That was actually a rather time-consuming process, not something that is easily done, and it has to be coordinated with the Department of Taxation and Finance to make sure the language is acceptable to them before the actual local action is moved forward and on the table. What I discussed with the legal counsel from the Department of Taxation and Finance was timing. He seemed to believe that the timing would probably take at a minimum 2 months, could take as long as 90 to 120 days, which will probably place us outside of this time period. More specifically, after I received that communication, I did send back several questions, questions that I believe the board has had interest in. One of the questions I posed was whether or not the Sales tax exemption could be applied to specific home heating fuel sources rather than just generically all home heating fuel sources. I asked whether or not the exemption could be for a designated period of the year rather than for all 12 months. I asked if the board were able to act upon it within the next 30, 60, 90 days, how quickly that exemption would apply. Because we are mid-quarter right now, this quarter's impact on sales tax really isn't felt until the beginning of April 1st. So the question was whether or not if the board acted right now, that exemption would be on hold essentially until that quarter started. I have not received answers back on those specific questions yet, but what I did discern was that it is a rather time-consuming process. Now, not to say that we could not get everything in order for next year. If the board decided that it wished to move in this direction, we could very easily pull things together during the course of the subsequent months and have things ready to go for next year if the board decided to do so.
Mr. Ray.
So really, that was highly irregular that we were discussing and tabled the resolution, but I still appreciate. But just because of Mr. Button's comments, what I will comment to the public, the North Country Now survey supported the removal of heating sales tax by 80%. Well, the public needs to know that at a minimum, this $4.3 million reduction in sales tax revenue would result in a 10% increase in their property taxes.
Any other discussion on it? No more further discussion? Okay, Ruth?
Just the vacancy resolution, Mr. Chair, needs to be moved upon. That was
Okay.
added at the beginning of the meeting.
Oh, yes, hang on. We have a resolution by Ms. Bianco.
Thank you, Mr. Chairman. I offer this resolution authorizing filling of vacancies. I move this resolution.
And is there a second? Ms. Kern, Mr. Perkins? Is there any discussion? No discussion? All in favor?
Aye.
Opposed? Carried.
Mr. Chairman,
Yes.
before we move on, I have reconsidered a vote that I made earlier in the meeting, and I'd like to change my vote on resolution number 15, opposing. I would like to vote no on that, please.
Okay, so noted.
Thank you very much.
Thank you. Okay,
Mr. Chairman, I have a hand up.
Mr. Manelli? Mr. Manelli, go ahead.
It could have waited for old and new business. I was also, I was reading through that resolution. I was absent when we did the committee resolution on that, and I did not vote when we went through that same resolution opposing the adoption of New York Wage Board recommendation. I was actually still reading through the resolution when the vote went through, and I did not vote one way or the other, so I would like to record as opposing the resolution as well.
She's talking about the same resolution.
Yeah.
Ms. Taggart. Yeah, it's at page 15. 15.
Number 15, yep.
Okay, that's so noted. Well,
Which one did she vote? She said she didn't vote. It was a voice vote. Did she?
You muted.
It was a voice vote. I did not raise my hand or vote in favor, and I'm sure that you could rewind the YouTube video and clearly see that actually.
Yeah.
you've got a real big echo going on, so it's difficult to hear you, but I think we know what you're saying. You want to vote no on it?
Yes, please vote no.
Okay, we
Yep.
got that noted. Thank you. All right, county administrator report.
Point of order.
Yes,
Please. I guess I'm just curious if that is something that we could legally do, go back and change votes and things.
You looking at
I
that?
don't have a problem with it. I just want to know.
County attorney's researching that right now.
I've seen it done before in the chamber.
So I'll go ahead and he can interject. I don't have
Sure.
too much to share this evening. The first item is a transfer of funds based upon local law C for the year 2011. I share any transfers below $5,000 between 200 and 400 accounts with you. I have a transfer from emergency services in the amount of $800. Based upon the expenses that they have incurred this year due to COVID, they need to transfer that amount. Wanted just to give you a short update and let you know what our priorities are at the moment as related to COVID-19. We currently have COVID positives in 5 departments, so we're continuing to work through making sure operations are delivered. We have 3 main priorities. As Legislator Akers inquired, we had 47,000 masks delivered. They are or have been distributed. We are also looking at seeing a fulfilled request in New York response of another duplicate amount. We will organize that and make sure we communicate for those legislators who'd like to deliver masks and make sure you're aware of how we plan to make that distribution when we get details on when they will arrive. Also looking to reopen the call center and public health to provide them with some assistance. And also looking at, as Jolene mentioned tonight, we're going to renew our request for volunteers with the clinic schedule she provided. Certainly looking at getting back into that community situation where volunteers were critical in delivering those services for vaccine. Certainly the boosters now, as we understand, many of our colleges are requiring that as a requirement to return. So we want to be helpful where we can, as well as testing. And that certainly got a lot of discussion tonight. So when we looked at the governor's map today, we saw an abyss between roughly Syracuse and Plattsburgh. So I made a timely request, as I have been requesting of our governor's rep, to take a look at that and see if there can't be some assistance. I do appreciate you considering the vacancy resolution and getting those through. Those are important for our departments. Also to Legislator Denisha, please pass along good health and birthday wishes to Mrs. Woodrow. Wanted to let you know that vacancy review is scheduled for tomorrow afternoon at 2:30. We will continue to do vacancy review meetings by Zoom, as I believe departments and legislators who attend have found them to be valuable, an easy way to get the work accomplished. Just so that now the rules of procedure have been adopted, that also means our schedule for 2022 has also been adopted. So I'll just run through this month for you. Operations will be next Monday, the 10th. County offices will be closed for the Martin Luther King Jr. holiday on Monday, January 17th. Services will be held on the 24th. And on the 31st, we will have the Finance Committee. So you'll all get copies of that finalized schedule once the resolutions are numbered and adopted. We will publish that full schedule. Also, your 2022 adopted budget books will be available to you within the week. Those who are attending by Zoom, we'll make sure to get those out to you as well. One of the things that you'll note, typically at the end of this month or the beginning of February, we typically have legislators and county staff attend the NISAC meeting in Albany. That has been rescheduled this year or scheduled this year to occur in the middle of March. So that certainly should make travel a little bit more amicable. But also, if you're interested and give that some thought, we'll be looking to see their schedule soon, and we'll plan to have some staff attend that meeting. The State of the State was just announced, will be broadcast live on Wednesday, January 5th at 1 o'clock on the governor's website. We'll send you a link just to make that easy. I was fortunate to meet with the governor, with Governor Hochul when she visited St. Lawrence County last week. We shared our concerns and also our challenges as of late. Our host, St. Lawrence Health, was gracious to share also the challenges in the hospital systems. And Chair Sheridan introduced the idea, a little bit off script as he called it, to maintain the Ogdensburg Correctional Facility. He was not shut down. He made points about the vacant facilities across the region and the need potentially to repurpose, to utilize OCF in this area to assist with the needs created with the population at Rikers Island. So it was a good visit, and overall, while it was quick, the next day, we started to hear back on the issues that we brought to the governor's attention. So we're grateful for that. Certainly, we will hope to connect those services and the needs where they exist. On Wednesday this week, as a follow-on to our ARPA discussion, I'll be meeting with the IDA and hope to schedule the ARPA committee to convene on Wednesday or Friday this week. So committee members, I'll be reaching out to schedule a time with you. On Friday this week, I'll be meeting with the Bonadillo group to discuss their progress and the first report that will be coming up to the Board of Legislators. This Wednesday afternoon, if possible, I would like to schedule that work session for the legislative agenda for 2022. We'll do it by Zoom to make it easier. And certainly if folks can attend for a period of time, some of it, all of it, let us know. I'll send that out, or have Rebecca send that out to you tomorrow. My hope is to bring that update to Services or Finance this month and approve that February 7th. Considering the governor's action as of late, allowing for state representatives to attend remotely, their presence in Albany may be a little bit different this year. So potentially we would be attending the district offices to deliver those agendas. We'll have to wait and see. Wanted to let you know I'm wrapping up our work. I am a member of the Cyber Primer Expert Advisory Team with NISAC to create a cyber primer for local government leaders. The draft document's currently in review, and I hope to share that not only with you, but be able to share with my colleagues as soon as that is ready. Did want to let you know that City of Ogdensburg satisfied their 2021 warrant last Thursday, as well as paid $137,000 toward the taxes due from 2005 and 2013. So in 2021, 7 years of back taxes have been satisfied, and 2020 and 2021 were paid in full. There are 3 years left to settle, and that balance of schedule has been put together by the city, and that total is $413,000. The historian, Nancy LaFavor, is pursuing our designation. She visited with us a couple months ago on the to place part of the county buildings on the National Register as a district. She'll be bringing forward a request to carry that process forward to identify the folks that can help us with that application. And on a lighter note, I did want to share with you the winners of our holiday event. I did want to thank legislators Larry Denisha, John Burke, and Rita Curran for helping out when they could on that day. We had a few categories for our event this year. Carmen Allen won first place in the cubicle decorating category. Wendy Morrill and Summer Merkley, these are all social services employees. Our office category was a conflict defender's office. And also real property, Lena Kenitz, I believe is how you say her last name. And then in the department category, the One Stop Career Center was our first place winner, and our second was the Board of Elections. So a little bit of fun with the holidays and hoping to treat them all to something special. So appreciate legislators' help, and we look forward to that in the future. Any questions?
Well, let's go ask a question. You, go ahead, Ed.
Yeah, Ruth, a little bit off the subject, but on the subject, probably could have been new business, I guess. I had someone reach out to me, wanted to know there was a sample tax bill mailed out to the city residents, all property parcels in the city of Oxford. Could someone give me a total cost of preparation, mailing, time, printing?
Everything put into that? Sure, I can get that for you.
The other thing I'd like to reach or give kudos to Bruce Green, he gave me a heads up today. The tax bills have gone out to the city residents, and anyone with concerns or whatever, he said just steer them that way, and I appreciate that. There is going to be some confusion, I'm sure, but he seems like he's on top of it. So let's see how it goes.
Okay, we'll get that for you.
Thank you.
Thank you.
One more item, just with the continued tabling of the resolution as it relates to official newspapers. I would just wanted to mention and make sure there's no objection. We'll continue with North Country This Week and Watertown Daily Times as they were the 2021 official newspapers until a determination is made to the contrary.
Mr. Akers.
So Ruth, on your meeting with the governor and actually the medical staff at the St. Lawrence Health System, Was there any discussion or acknowledgement of the medical staff shortages at the hospital in relationship to the vaccine mandates for health workers?
Not specific to the vaccine mandate being the reason, but a staffing shortage, mostly focused in our discussion on nursing and a conversation about different types of either vocational through BOCES or different potential schooling setup for those types of education to be brought so that folks could either stay here, get their education, or come back here.
So I've been made aware that over 100 employees were fired from St. Lawrence Health Systems by a constituent of mine. And then actually some that actually left when the mandate came out. The other thing that I talked to you about personally was, and that the $65 million that the Governor Hochul has set aside for enforcement of this regulation 2.60. I asked that money that maybe somebody could talk about actually getting a booster site here in Potsdam or someplace here in the North Country, because I realize the success of our own. I think we believe we had over 600 individuals. And I think there's a demand. You're 2 to 3 weeks out for booster shots. I think people are looking for them during this holiday season, which is now gone by. So was there any mention of actually a booster site? Obviously, there wasn't any mention of taking that 65 million, putting it towards a booster site. But was there any mention of a booster site possibility here in the North Country, other than the kind of failed one there that took place in Jefferson County as far as staffing?
I asked about a testing site countywide.
Yep.
Didn't get any positive.
No, and initially the state came out with a combination test vac site. I think they're backing away from that now for a variety of reasons. We talked about a vaccination site, so not specific to boosters, but vaccinations for first dose, second, and boosters as well, and just indicated a need to have additional supply available as well to counties.
Well, at our last public health meeting, we discussed, I thought there was somewhere between 600 and 900 people that actually are getting vaccinated weekly, and that is not the case. Those are second shots or booster shots. So Dr. Williams has said that he felt that number, or Joe Lee did, that the number was about 60 new people per week. So even after the Delta that went through St. Lawrence County and the deaths, people that we know of or whatever, people are not going to get vaccinations. So that's why there's a great demand for a booster site, because those that are vaccinated are looking to get boosted. And I thought that should be where our emphasis should be.
And certainly we see, and Jolene reports on a weekly basis, we see about anywhere between 0.3 and 0.5% change each week, which doesn't represent the number necessary to get there.
Thank you.
You bet. That's all, Mr. Chair.
Thank you very much. Any old or new business to come before the board? Yes, go ahead, Nicole.
Thank you, sir. Ruth had mentioned that the NISAC conference is going to be in March. And I just wanted to let everybody know that there is a call for resolutions for all standing committee members. And I know I sit on the public employee relations as well as the economic development, environment, and energy standing committees for NISAC. And we have several other legislators that sit on standing committees. So I would encourage you through the course of this month between now and the 31st, while you're meeting with your committees that you sit on, the different councils and advisory boards that you sit on, to make it known that NISAC is accepting the resolutions to come before the standing committees in March that will become part of their platform and their push in Albany, so that we can, leverage our membership in the NISAC organization.
So noted. Any other old and new business? None? Yes, go ahead, Mr. Smithers.
On some of these reports, particularly the COVID report tonight.
Yes.
On Jolene's, I couldn't understand or see anything. On Dr. Williams, I could hear every word and understand it and see most of his, like 90% or more of what he had on the draft. We used to have a screen back here. I have 20/20 vision, and I couldn't read a single word that Jolene put up there. So I don't know about everybody else, but I didn't get much from hers. I don't know if this is possible. We can do.
Mr. Chair?
Yeah, go ahead, Drew.
I think a couple of things. I think the presentation that was given tonight was in presentation mode rather than full screen mode. But I also agree, even from where I sit, it was very difficult to see. I can talk with her about getting some of those, less text, more graphics in a larger font so we can see that further out.
Thank you. No more further, old or new business, going to executive session. Is your name, Brooke?
Yeah. Yes, sir, there is. There is for personnel. One moment. Which is, yeah, I'm gonna have this pulled up. The medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and appointments.
Is there a motion to go into executive session by Ms. Stern?
Point of order, Mr. Chair.
Yes.
Before we go into executive session, I'd like to know what the ruling by Mr. Button is on my request.
What request is that? Do you know?
I do. Yes. Ms. Haggard and Ms. Terminelli indicated that they would like to change their votes with respect to a prior resolution. I have actually found the rule that applies, which is on page 46, associated with Robert's Rules, 10th edition, which identifies specifically information that I found the advisory opinion on first. I think the advisory opinion is very instructive to everyone. The advisory opinion says that there are two chances to change your vote. A member may change their vote up until the chair announces the result, or after the chair announces the result by unanimous consent of the body. However, once the chair announces the next item of business, it is not possible to change an individual vote. Occasionally, it happens that later in the meeting, thinking back over events, someone decides that the chair made a mistake in calling a voice vote. Since nothing was said at the time, it's just too bad. That's exactly what the advisory opinion says.
Okay, Mr. Button, may I ask if my comments would still be in the minutes of the meeting, and even if I can't change my vote, I'd like them included in the minutes.
Yes, ma'am.
Thank you, sir.
Mr. Forsythe?
Well, just to get technical, Nicole didn't. So how would we address that one?
A non-vote is a no vote.
Okay.
Okay. Executive session again. We gonna go into it?
Yeah.
Motion been made, seconded. We all
We can do it again.
Okay.
And take a vote.
Yes.
Opposed? Right.
That was board reappointment, or for an appointment, Christopher Velez of Herman. For reappointment, Thomas Conklin of Governor, Mark Omnier of Rensselaer Falls, Joseph Finnegan of Madrid, Joseph Gallagher of Potsdam, and Kevin Crosby of Morristown.
Can you move those names?
I love those names.
And the seconded by Mr. Perkins. Any discussion on those names? All in favor of those names?
Aye.
Opposed?
Thank you, Mr.
Anyone opposed? Carried. And Mr. Akers?
Mr. Chair, for appointment to the St. Lawrence County Workforce Development Board, I offer Ben Dixon of Canton. For reappointments to the St. Lawrence County Workforce Development Board, I offer Dale Rice. For St. Lawrence County Soil and Water Conservation Board, District Board of Directors, Adam Cook. And for St. Lawrence County Trails Advisory Board, I offer Roger Bennett. I move these appointments and reappointments.
For a second. Mr. Dave Forsythe seconds it, and all in favor?
Aye.
Opposed? Carried. Anyone want to make a motion to adjourn?
No,
Wait,
yeah.
we gotta.
Oh, yeah, that's all. Go ahead.
And Mr. Chairman, make a motion, approving a contract with RCI,
10 days.
for $13,500 to be used for contingency for the purpose of hiring RCI to recruit a commissioner for social service.
Check it.
Yeah, that's, second by Mr. Forsythe and Ms. Kern, Mr. Perkins. And, any more of the discussion? Somebody else wants a second?
I did, but you didn't see me.
Do we need a roll?
Who is it that said that?
Mhm.
Joe, okay, Joe.
Lightfoot.
Second, Joe seconded it.
Thank
you. Okay. All right, any discussion? No discussion, all in favor?
We need a roll call.
Opposed?
We'll need a
We need
roll call.
because it's appropriate.
Need a roll call?
Yes, sir.
Roll call, Charles.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes,
Piaco,
Yes,
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins.
Yes.
15 yes.
Resolution, that's approved. Who wants to make motion to adjourn? Go ahead. Motion made by Mr. Dave Forsythe and moved and seconded by Mr. Perkins. And all in favor?
Aye.
Opposed? Adjourn.
Now, Kevin, you'll have to tell me, this is 8